Hello, hello, hello. This is Dr. Eunice. I am coming back with another topic, Introduction to Sociology. I am teaching this course for a college class that I'm teaching, a university students that I'm teaching, but I realize that anybody else could be watching it. So yeah, welcome to my YouTube channel. I am so glad to have you as one of my viewers today. Whether you're here because I sent you here, I sent you the link, or if you just found this um, lecture on here, I really thank you so much. I'm grateful that you're watching my video. If you enjoy this content, please do not forget to subscribe to my YouTube channel. I would love for you to tap the notification bell so that you can stay updated and you can be notified whenever I upload a video. You can give me a thumbs up if you learn something from this video as well. I would like you to engage me. You can leave me thoughts, questions, comments, suggestions, anything. Let me know if you want to cover a particular topic that maybe you're struggling to understand and I can help you. I would love to do that. I hope you have also watched lesson 2 of this class because we are actually progressing to lesson 3. Where we have, in lesson 2, we talked a lot about the many known theorists, which was quite important. So for the future sociologists today, we're going on a thrilling adventure through the world of sociology. But first, let me just warm your sociological muscles up. I know that you have probably watched this. This is the second or the third time that you're watching my sociology lectures. So I have this mind game. Imagine you're a detective exploring in a new city. Maybe that is your city where you live or your village. What is your mission? And your mission, I'm guessing, it is to uncover the hidden social structures, norms, interactions that shape your community around you, whether it is in college, at the hospital, working, wherever you are. So get ready. I want you to put on your sociological hats as you start this journey of discovery. And I want to walk you through the rest of the materials that I have prepared for you. So get your pen ready, and of course your paper or your notebook or your notepad, whatever you put your notes, because if you're in my class you probably find some of this information in the exam. Okay, so I want you to think of sociology as the GPS of human behavior that guides us through the maze of society's unusual behavior or habits and curiosities with just the right mix of insight and some seriousness. Yeah, because it's a lecture and your Dr. Eunice is helping you discover these behaviors. Okay, so we are all curious when it comes to sociology careers. So I want you to think of yourself as the ultimate superhero that is going to put on that superhero outfit or that superhero hat and try to understand the stats in your society in terms of the population versus the needs of those people that are living in that population or in that city, on that village, or that institution. And you're getting these stats or statistics because you deeply care and you're ready to fight against any unfairness or any wrongdoing by the politicians or the policy makers or the leaders of that community. So I want you to help me or help those needs. You want to help and probably solve some of those challenges or solve some of those community needs, and probably involve equality, the quality of life, improve the quality of life in those people that you care for. So this is really why we're here today, to talk about some of those things. And we're going to start by discovering the essential wisdom of sociology. So as we begin our lecture today, what is the wisdom of sociology? The wisdom of sociology is the understanding and application of sociological principles, theories, and methods that help us better understand and navigate the complexities of human society and social behavior. So this wisdom is going to provide a unique perspective on issues such as inequality, power dynamics. I hope if you have listened to me enough, you know that I really care about marginalized groups. I care about those people that are affected by inequality and power dynamics, and cultural norms, and can be applied to improve individual lives and create a more just and equitable society. So by using sociological insights and tools, we want to gain a deeper understanding of the social structures and processes that shape our world and identify opportunities so that we can make positive change. And how do we do that? So, before I touch on understanding sociology, let me talk of an example of how wisdom of sociology operates. So imagine a group of friends planning on a trip, maybe go camping. So one person suggests making decisions democratically, with everyone having an equal say in choosing the location where you're going to do the activities, where you're going to camp, where you're going to do your meals. Another friend disagrees, arguing that they should follow a hierarchical structure with a designated leader making all the decisions. Okay? So picture where you are. Are you for the democratic? Are you for the hierarchical leadership? Here, the wisdom of sociology can help the group navigate this situation by applying sociological principles. So they can discuss concepts like group dynamics, power structures, and consensus building to find a solution that best suits their needs and preferences. So by understanding sociological theories such as functionalism or conflict theory, like we talked about Karl Marx, they can better analyze the dynamics at play and make informed decisions to ensure a successful and harmonious trip to go camping or whatever they're doing. So now let's talk about understanding sociology. Sociology careers offer individuals the opportunity to contribute to our understanding of society. So sociology career allows you to investigate social issues like crime rates in neighborhoods. We know that we have countries where crime rates are high. I'm not saying that any particular country we can say that doesn't have crime. Every country has crime. Every community has crime. Every neighborhood has crime. And work on solutions to improve those communities and maybe reduce the crime rate. And what are some of the things that would be done to reduce or eradicate crime such as murder or shooting, mass shooting, and things like that? Sociology studies social structures, institutions, and processes to analyze how they shape human behavior and interactions. For example, sociologists might explore how social media affect self-esteem or how educational policies impact students' outcome. So this research helps us understand and navigate the complexities of human behavior in different social contexts. So I'm thinking that some of those students that will not want to go to work right away and they want to go to do their master's degree, and you can hear that I'm giving you some of the hints where you can actually further your education in doing research. This understanding is crucial for addressing social issues, promoting social justice, and improving the well-being of individuals and communities. So we have to have data. We have to have, data-informed or evidence-based strategies to be able to improve lives of people in a community. So informing policy and practice. That's what we're going to talk about. Sociologists play a very key role in informing policy decisions and shaping social practices. So through research analysis, sociologists provide evidence-based insights into social problems. For example, in healthcare access, sociologists may investigate disparities in healthcare access and outcomes based on factors like income, tribe, social status, race, and even the geographic location. So that kind of a research can help policymakers develop strategies that can improve healthcare access and also reduce health inequalities. So through conducting research and be able to get data that can inform the policymakers to know which parts of the country, which parts of the world have been impacted by lack of healthcare access. They help policymakers and practitioners develop effective solutions and interventions to address societal challenges. So let's think of a real policy and practice. Imagine you are passionate about reducing homelessness in your community. So as a student, you're interested in sociology, you could conduct research to understand the root causes of homelessness and the effectiveness of different interventions. I don't know if some of you know that I established a children's home back in 2013. That children's home is still going strong. But we do know that some of those things that can be affected by policy. And I really care about my country, Kenya, because when I see some of the things that sometimes are said by politicians or political leaders, and things like eradicating or making sure that they're closing the children's homes, and I wonder what type of data they use. So for instance, you might analyze data on factors like housing affordability, employment opportunities, and support services for homeless individuals or people or families that live in the streets. We know that we have that problem in the country. We still have children that live in the streets. Based on your findings, you could then propose policy recommendations to policymakers, such as increasing funding for affordable housing programs or expanding access to mental health services. So, this is very important because these are some of the things that we have heard our leaders talk about, especially in the recent. And I would also wonder or ask myself, what type of data do they have to actually support this type of policy? Because they want to build the affordable housing, they want to they're improving the mental health services, which is very, very good. But I also hope that is data informed. So your research and recommendation help the policymakers and practitioners develop more effective solutions and interventions to address the societal challenge of homeless or street families. By applying sociological principles and methods, you are contributing to positive change and making a difference in your community. It is as simple as that. I know it's not simple. Research is very hard. I have done a lot of research, especially in Kenya. My PhD was, I did a whole entire 7 years of research. But I can tell you it is very hard to implement, findings in some areas because of lack of funding. So let's talk about promoting social justice. So sociology careers often involve advocating for social justice and equity. Sociologists work to identify and challenge systems of oppression, discrimination, and inequality. They promote policies and practices that advance fairness, equality, and human rights in society. I want to give an example of human rights advocates. Sociologists may work for human rights organizations. There's those human rights organizations, both domestically and internationally, advocating for the rights of marginalized and oppressed groups. They may conduct research on human rights violations, document cases of injustice, and work to hold governments and institutions accountable for their actions. So these are some of the things that human rights advocates can do, and that those ones fall under the field of sociology. This work could involve lobbying for policy changes, providing legal support to victims, and raising awareness through media campaigns. So these are very, very important activities that can be done, because we know there's a lot of injustice that happens all across the globe. I mean, it's not just one country. There's every country has its own level of injustice. So to talk about the social work, and I hope you remember that the theorists that really worked hard for sociology to be actually an academic discipline. So social work is an academic discipline and practice-based profession concerned with meeting the basic needs of individuals, families, groups, communities, and society as a whole in order to enhance their individual and collective well-being. Social work is also referred to as healthcare-based profession that helps people, communities, and organizations overcome personal, economic, and social changes. I know in countries like America, where we do have clinical social workers, so they do work in the healthcare industry or profession, and healthcare-based profession, while social work is not limited to healthcare settings, it often interacts with healthcare systems to address the social determinants of health. I don't know if you would, I would care to check to see whether your hospital has a social worker, to check whether your university has a social worker, because these are very, very important people, important professions. Social workers in healthcare settings may assist patients and their families in navigating medical systems, assessing resources, coping with illness or disability, and addressing psychosocial needs that impact health outcomes. So even if you're not becoming an occupational therapist, because I know most of my students are occupational therapists, or others are doing clinical psychology, others are becoming, they're going to become licensed as counselors or marriage and family therapists. So this is very important to know that you all have a very, very important role to play in the lives of other people. So when you talk about holistic approach in social work, what are you talking about? This holistic approach means that a social worker uses many tools, skills, and resources to support people in need, including, and it's not limited to the things that I'm going to talk about here. So we're supposed to be helping the clients navigate the legal system to solve legal issues. You can also be working with your clients in communicating with other healthcare professionals, such as primary doctors or school counselors, on behalf of the client or the patient. Connecting clients to community organizations for additional services or assistance. For example, helping someone get assistance to pay their rent, because those are some of the things that social workers or even people that are in this field do a lot, especially in countries where those services are available through institutions like even churches or even government agencies. Advocate for change and social justice. This is something that you're probably gonna hear a lot because it's sociology. So advocate for change and social justice with non-profit organizations, legislatures, and other governmental bodies. Providing clients and their families with basic counseling services, counseling and support. I also talked about some of the things that people that are in this field do. The social worker provides individual and family counseling to address the emotional and psychological impact of even things like homelessness, the house got burnt and the family doesn't have anywhere to live, so they have trauma, and the counselor or the social worker who is clinically trained can actually be able to provide therapy. So they offer support and guidance to help the family navigate the challenges they face and develop coping strategies in order to build resilience. So as a licensed clinical social worker, especially in a country like US, you are trained to diagnose and sometimes treat the client for behavioral, emotional, or mental health issues. So depending on the country where you are being educated in this field, you could probably be required to get more training. I know that some of the people that even not just psychology, but even things like counseling, you would have to have a master's degree in a country like the US to be able to practice as a therapist or as a counselor, and also be able to do some exams and pass those exams. So it's not everybody that gets to do these things just because of doing a course in sociology or social work. Okay? Just be careful. Make sure that you follow the laws and the policies and ethics of your particular country when you are. Don't quote me. Yeah, I have to say that. I have to give that disclaimer. Okay. So the different types of social workers. So there are 3 types. Which I can quickly explain. Community social workers, they strive to heal and fix communities. They assess problems and work to implement systems that solve them. And then there is the criminal justice social workers. They advocate for those in the criminal justice system and their family members. They may connect those charged with crimes and their families with resources. So maybe you have a family that their son has been jailed and they don't have a lawyer, and you can get them a pro bono lawyer. Or maybe you have a family that mom and dad have been jailed and you want them to continue communicating with their children, so you can be providing such type of support. So medical healthcare social workers, which I also talked about, they being referred as clinical. So they offer services to clients needing emotional, financial, and other types of support. They can help patients and their families form post-discharge plans and connect them with community resources. They can also provide counseling as patients weigh medical options. Okay. So military and veteran social workers. Actually, I said 3, but I'm talking about 5. This is what I'm seeing over here. Okay. So the 4th one is military and veteran social workers. Work with those serving in the military in another option for social workers. They counsel clients and support their families. They also help clients transition to civilian life. So that there are people that serve in the military. By the time they're coming back, they have PTSD, which is post-traumatic disorders, and so stress disorders, and they might need support to actually be able to move or transition from the military life to transition to civilian life, and also support their families because of separation and things like that. And sometimes maybe the family members have lost their loved ones in the war or things like that, and you have to be able to support them. So they are employed to do that by the military. This is mainly in the US, and I am hoping that other countries, like even in Kenya, and even, we do have this type of social workers working for our servicemen. Okay. Child and family social workers, this would be regarded as is it called children's worker? Others is child welfare. So they help vulnerable children in unstable homes and those who have undergone trauma. So sometimes I have done this type of a job, especially in America, as a foster care worker, where I had to place children in safe homes when they had been removed because of abuse. And now that I have a children's home in Kenya, I work closely to children's officers because they are the ones who bring the children that have been abused to the home for safety. And so we work with them and help them go through the trauma. So those can also be referred to as child protective services or children officers, depending on the country where they are working. Okay. So what are some of the skills that are must have for a social worker? And when I talk about social worker, I'm talking about occupational therapists, anybody that works, with human beings out there. I mean, that's the one who is called social worker. Anybody that their career actually falls under the sociology category is a social worker. So you don't have to have that title as a social worker, but I do know that there are some places where, because of licensing, the social worker is just a social worker who has completed social work, academic degree. But as we also say that, people who have done other degrees, like the sociologists and the ones that we mentioned above, their community social workers, family and child family social workers, and people like that. So what are some of the skills that they must have? Because social workers can take on a variety of roles. They are expected to have a wide range of skills, and I'm not giving an exhaustive list of the skills that they must have, but there are certain skills all social workers must or should have. One of them is emotional intelligence, which is we also refer to as EQ. So this is the capacity to be aware of, control, and express our emotions or one's emotions, and to handle interpersonal relationships judicially and empathetically. Social workers must be self-aware and be able to decipher the emotions of those they are helping. So if you don't have self-control, you also have to be to be able to know how to express your emotions, when to control those emotions, because you cannot be immersed in clients' misery and not be able to control your emotions, because you might also not help them actually deal with the emotions. So emotional intelligence is very, very important. So the other one is, of course, listening. You must be an active listener. When clients feel they're being heard, they are much more likely to share and develop trust with a social worker. Sometimes, some people think that because someone is coming into your office for counseling or to ask for help, that you have to be the one that is speaking all the time, giving advice. But it is also very, very important to listen, and also being a good listener. So tolerance, being tolerant of all clients and treating them with respect is very, very critical. So if you are a social worker and you really hate people, or certain group of people, I don't know how that would really work for you as a career, because it wouldn't be helpful. And I mean, just looking at someone, and maybe somebody came to your office and they're drunk and they're high and they are irritable, they're irritating you, they have a mental disorder. So just being able to respect that type of a person is very, very key. So another one is being able to communicate. So communication. Social workers have difficult conversations with their clients, and in some cases, the families of their clients being able to communicate clearly and effectively is an especially important skill for social workers, because you have to be able to communicate. And sometimes that is when it is required that you have to communicate. If you don't know the language of the client that you're serving, you might need an interpreter, or you might actually say that you're not able to provide services because you have to be able to communicate with that person. Maybe it's somebody who has hearing issue, or maybe they can see, they're blind, and you might be able to actually find professionals who have those skills that they can be able, so that they can be able to communicate effectively and meet the needs of that client. So you cannot assume that you're able to meet the needs of that client if you're not communicating. So of course, strength. Social work is emotionally taxing. I know there are times that I really felt like, whew, this is hard. Tough things that you get to meet there. You get to meet people who are mourning somebody's, young family, both parents have died or things like that. They're in your office, and so social work is very emotionally taxing with painful and heartbreaking situations. So a social worker must strive to heal and help others. So you're trying to help other people, and at the same time, you have to be able to heal out of that heartbreak. So imagine if you're in a place where there is war or something like a mass shooting, and you're the social worker. You have been broken. Maybe you have even lost a loved one, and you are also required to be able to help. So that's the type of the emotional strength that you're required to have. So this requires a lot of resilience, definitely strength. So compassion, you have to really be a compassionate person. The ability to set boundaries and apply organizational skills. One must have empathy and compassion to be able to connect with clients. Those are two very important things. So empathy and compassion. Active listening, as I talked about being an active listener. I talked about listening as a point number 2. So active listening skills are going to help social workers understand clients' needs. In addition to the skills, one must have effective communication, which I talked about is also crucial for conveying information clearly. So the other one is cultural competence, which is necessary to work effectively with diverse clients. People who don't have, for the students that have done my cultural diversity course, you probably understand what I talked about, cultural competence, which is very, very important to be able to work with people, without being judgmental and without biases, so that you can be able to work effectively. So for example, maybe you are a Christian who probably hates Muslim, or the vice versa. You're required to actually go for probably some cultural competence class, so that you can be able to minimize some of your biases, because you can't help a client if you have those biases. So problem solving skills assist in identifying and addressing challenges. So you also have to be advocacy, to be a person that can really advocate, so that you can empower your clients and also promote their rights, to really tell them that this is your right, you need to ask for this benefit, you need to go to this office, and you have to be somebody who can really empower your clients, because by the end of the day, you cannot solve all your problems or your clients' problems, but you can lead them to organizations or agencies, or at least tell them some of the places where they would go and get those benefits, and that might require to be empowered. So ethical practice ensures integrity and respect for clients' rights. Also, being somebody who can really keep confidentiality and not break confidentiality, because some of the information that people share with you is very, very sensitive. So you're not gonna go talk to everybody and say, oh, so and so is in my office and they are breaking up with with her hubby, and you have to be able to keep that information privately. It doesn't matter where you're treating people, whether it is in the hospital. It is not your place to go announcing or just giving other people information that doesn't without permission. And this is something that you can also learn in a different class. Especially, I'm thinking about counseling practice, where you're gonna be talked about the ethics. Yeah. So collaboration with other professionals enhances support for clients. So other skills that I'm just talking about that I might not have put in my notes, but I'm thinking about multidisciplinary strategies, or having those meetings with other people that can provide services for your client, because you might not have everything that that client needs in your office. So maybe you are seeing a client and you are an occupational therapist, and maybe you realize that that client also has asthma, or maybe that client also doesn't have a housing. So you can actually collaborate with other professionals so that you can support this client adequately. Self-care and resilience are essential for managing emotional demands. So you, as a social worker, because of the type of work that you do, it is emotionally draining. Be able to have supervision with your supervisor, the people that actually help you with self-care, going to the gym, going to walk, just making sure that you really take care of yourself so that you can renew your strength for the next day. It is very, very important. Otherwise, this is a job that can really, really take a toll on you. Okay. Um, all right. So I think we are going to talk about this guy called Peter Berger, 1963. He's really known for the phrase "see the general in the particular." So, to identify general patterns in the behavior of a particular people, he says that seeing a society in an individual, being able to see where an individual came from and what they believe based on how they behave. This views that age is a social construction. Um, Although societies define life stages differently, there are differences by social class within the same society. According to Berger, in a society, there are many groups with different cultural ideals and practices. So what does see the general in the particular really mean? So for an occupational therapist, for example, seeing the general in the particular could mean understanding broader principles of therapy by maybe focusing on a specific client case. For instance, an occupational therapist might work with a specific patient who is recovering from stroke. By closely observing this individual's progress, challenges, and the specific needs, the therapist can actually gain insights into effective rehabilitation techniques and strategies that can be applied to other stroke survivors with similar conditions. So, this individual case study provides valuable information that contributes to the therapist's overall understanding of stroke rehabilitation methods, enabling them to better help future clients with similar needs. So that is actually now applying the see the general in the particular. That's another example of trying to understand what he really meant. Okay, so let's talk about Judith Butler, 1999. She says that gender she sees gender as a social construction. Gender is not inherent or biologically determined, but it is socially constructed. So Judith Butler, a prominent gender theorist, introduced the concept of gender performativity. According to Bartle, gender is enacted and reproduced through repeated performances of culturally prescribed norms and behaviors. So this perspective challenges traditional understandings of gender as fixed or natural, highlighting its fluidity and variability across different contexts. So what it's really talking about is, because of, where we are raised, how we are socialized, it is not just the biology that tells us I am a woman or I'm a male. It is, what are those other gender expectations? What are your cultural norms when you get up? When you get out of that womb and you come into this world, you find your mommy and your daddy have bought you clothes. Those clothes are already for a female. They are a certain color. Then when you start growing up, what they provide for you, the toys that they give you, if you're a boy, they'll give you a car, or they might give you balls, or if you're a girl, they might start giving you purses and makeup, kits and things like that. And then maybe a certain period when you grow up around 14 years for a Kikuyu boy, maybe in a tribe like Kikuyu, in Kenya, you are taken through the initiation process whereby you go through circumcision and things like that. So what Judith is really trying to say is that more than biology, our gender is usually determined mostly by what the society has really has really taken into consideration as gender appropriate. So for example, if you're a woman, so first at a certain age, people will start asking you, you're not getting married. Then when you get married, after a few years, people will start asking, you're not getting a child, are you not giving birth, are you not getting pregnant, and things like that. So those are some of the things that, the activities or the norms and the behaviors that she's talking about to actually explain what she says. So for gender construction, so social construction of gender is a feminism and sociology therapy. Society determines the image of gender. Further to societal variations in gender outlooks, one could see gender differences by social class in the same society. So society has so much to do with decisions women and men make. Especially things like childbearing. Social forces are at work even in apparent cases of self-destruction. So sometimes, you push so hard, you're not getting a job, you're a man. Why are you not getting a job to provide for your family? So sometimes that can cause, even depression and even later suicide. So I'm leaving that there. So obviously we are going to continue next time in the next lesson, but think about your role in your society that you live in, because there's so much that you can do. Is the advocacy, that you can do. You can do research, you can help inform policy, but you can make a difference. Whatever good difference, whatever difference that you make, I hope it is positive. Okay, so thank you for listening. Share this video with anyone that wants to listen. This is a good video that I think that can be used even to train our leaders on some of the things that they could do to really know how to make changes in certain areas of the country that they lead. Thank you very much. All right, bye-bye.